My name is Sierra Myers. Today I'll be presenting my cognitive behavior therapy presentation. You'll also hear me refer to that as CBT as part of my social work practice course. I am a student in at Vincennes University for social work. The focus is on how CBT helps change thoughts and change lives. CBT, cognitive behavioral therapy, is one of the most effective, widely known, used forms of talk therapy. It helps people identify and change negative thoughts, patterns that affect how they may feel or behave. In this presentation, I'll cover the origins of CBT and the main components, techniques, and applications. The creator of CBT was founded by Dr. Aaron T. Beck in the 1960s at the University of Pennsylvania. He was originally trained in psychoanalysis, but noticed certain patterns in depressed patients that led him to develop the cognitive behavioral therapy technique. He was also influenced by Albert Ellis in rational emotive behavior therapy, and that's also known as REBT. Core ideas of cognitive behavioral therapy. The main core idea behind it is that the thoughts, feelings, and behaviors are all connected. By changing our negative thoughts, we can change our emotions and behaviors. Cognitive behavioral therapy focuses on the present rather than the past, and it is structured, goal-oriented, and time-limited. An example of that would be a client who constantly thinks over and over, they have this in their head that I am a failure, I can't do anything, learns to question and replace that thought with something realistic like, I made a mistake, but I can try again, and I will try again, and I will do better. Cognitive behavior therapy techniques uses several different techniques, including cognitive restructuring. It's to identify and challenge negative thinking. So an example of that is like when you mess up on something, your first thought is, oh, I'm so stupid. Be like, no, that is okay. I can make mistakes. I will continue and I will get this right. Behavioral activation increases positive activities, which encourages increasing positive activities. Exposure therapy. This is a way to help people face their fears in a very safe manner. Homework assignments, which allow clients to practice new skills in between sessions that they can work on individually at home and challenge their cognitive thinking as well. Populations that work best with cognitive behavioral therapy is effective for a wide range of populations and issues, including those that suffer from depression, anxiety disorders, PTSD, which is also known as post-traumatic stress disorder, panic, phobias, substance abuse, and also anger management. It works well with children, teens, and adults. Cognitive behavioral therapy is also adaptable for individual, group, and family therapy sessions. A typical cognitive behavioral therapy session includes reviewing the client's weekly moods and experiences that they've had, identifying the negative thought pattern, examining evidence for and against that thought, and creating more balanced thoughts. This session ends with setting weekly goals. A simple way that I have gone to remember how examples of cognitive behavior therapy session would be to thought, feeling, behavior cycle. Strengths of cognitive behavioral therapy. Cognitive behavioral therapy is an evidence-based and highly researched. It teaches lifelong coping skills, is short-term and goal-focused, and can be combined with medication or other form of therapies that somebody might need. limitations of cognitive behavioral therapy. However, cognitive behavioral therapy may feel too structured for some clients. It doesn't focus on deep underlying issues that somebody has had, like past trauma or some type of other psychological issue that they might have. Cognitive behavioral therapy does require active participation and homework compliance, so you have to be very active and willing to do the work, as well as whoever you're working through the CBT therapy with. They may give you things that you can work on at home to start to get all the full experience of that. References that I have used to help comply this research assignment. The researches that I use for this presentation include works by Beck, works by Hoffman, Wright and Sudak, Dobinson, and guidelines from the American Psychological Association. And that all pretty well concludes on what I have. So thank you.